clinical work, basically, patient-centered care boils down to identifying what patients' needs are, first of all, and then follow a path, and provide a pathway rather, so that the patient, and that would involve, working with the patient to help make decisions, working with other team members and things like that. So with the first facet, which is embark and clarify, we decided to use empathy as the affective facet. Rather than curious, you're not really curious about what a patient is all about. So you really want to empathize with them and try and arrive at a diagnosis to help them. So therefore, we changed that to empathy. Then the next facet was find and generate. So for find and generate, of course, you can be determined to find, but the way we thought, because, this patient may not come back to you again. So we have to make the best of that opportunity to gather the most of information there. So we thought a meticulous approach was very important. So I used the word meticulous there. And then in terms of evaluate and reflect, that was discerning. We did not change that facet. So we stuck to that because they need to learn to discern, and that was fine. And even organizing and managing, the harmonization or harmonizing aspect, we did not change that. That worked well. And with analyze and synthesize, also we said creative. But the way I used creative in terms of diagnosis was not to make up the diagnosis, but really in terms of creating a diagnosis using all these different tools and information and knowledge they've got, and trying to go and think about what's in the literature, what they've found, and how they are arriving at a diagnosis. So in that sense, it was creative. And then, of course, communicate and apply, that we just left it at constructive, because that's, of course, very important. They need to learn to communicate with their supervisors, their patients, their radiologists, family members, colleagues, those sort of things. So all that we kept this. And then in the rubrics, we found, or when I was looking at the self-assessment, and when I asked them to do self-assessment, I'd also asked them to put in a little reflection at the bottom of their marking their rubric. So apart from saying, yes, I'm a HD here or I'm a D there, they needed to just write a reflection. And I did not actually make it explicit to think about each facet. I just wanted them to say how they went with their learning process. But I found a lot of students actually used those facets, and they said, in terms of empathy, we need to do this, we have to make sure we do that, that sort of thing. And even their language, I think I've analyzed this well. I probably have just described this aspect and not analyzed it as well. So they use the terminology, and so I think I've synthesized and integrated resources well, and I've applied that. So they used all those affective facets there. And so that was really nice to read their reflective pieces there. And even in terms of online discussions, that came through very well, even though I did not make it very explicit in the discussion, because I was just kind of journaling how they were going, and just to see if that's a part of. So then, empathy, fear, anger, if all sorts of emotions in relation to a misdiagnosis, for example, or the connotations of that diagnosis and implications it may have for a patient. For example, if there's an abnormality, a patient has to terminate. So all these sort of facets actually came through quite well in the conversations online with virtual classrooms.